Good afternoon, Virgin Islanders at home and abroad. I just want to say it's a beautiful day in the Virgin Islands as we push toward the holiday season. But today I must begin with a tribute to an outstanding Virgin Islander who made an impact on his home island of St. John and the greater Virgin Islands community. Robert O'Connor Jr., or Bob as many of us have nicknamed him, was many things to many people. Most remember Bob as the former senator at large, who was a fearless leader and advocate for the people of St. John and their advancement. He was also well known for his business acumen and notable public service contribution as a one-time chairman and long-serving member of the Virgin Islands Port Authority Board, where he led and oversaw improvements to the territory's port infrastructures. Others know him as the namesake of the Virgin Islands Port Authority's maintenance building at the Cyril E. King Airport, which was named in his honor just this year, 2020, and which I had the privilege as governor of signing into law. To me, he was a valued advisor, a close friend, and I valued his insights and his sage advice, especially when it came to politics. I will hold close to my heart our conversation, especially our last one, just days before his passing, where I congratulated him on the passage of the coastal zone permit for Summers End Marina. He certainly will be missed, but he lived a good life and will always be remembered by Virgin Islanders like myself. Yolanda and I, along with the entire family, extend our deepest condolences to his family, his friends, and especially to his wife, Clarice Commission O'Connor, his daughters, Jarrell, Francesca, and Francelis O'Connor, grandson, Robert, and all of the community who mourn his passing. As of today's date, we have tested 2,248 people for COVID-19 since our last update on last Monday. Of those 2,248 people, 114 tested positive, which means our COVID positivity rate for the week is at 5%. That is fantastic news. Much love and big ups to the community and especially our health professionals and all of the law enforcement. Everybody's out there trying to keep people safe. We ramped up testing and we think we finally got ahead of this last night. I think we had 10 out of 428 people tested. Just a beautiful response. Let's keep it together and keep moving. This morning, we're under 150 cases. We're at 146, which is another great step in the right direction. We have tested 33% of our population at 33,748. And of those tests, 31,745 came back negative, as well as 1,921 that came back positive. 1,752 of those individuals who have tested positive since March have successfully recovered. As far as hospitalizations, this morning, God bless, we have 2 COVID patients at the Juan Luis Hospital, one of whom is on a ventilator, and 1 COVID patient in the Schneider Regional Medical Center. That means there are now only 3 people in the hospital. That's always good news. Our prayers go out for them, their families, and the loved ones in getting them well again. By way of update, last week we spoke about an off-island wedding that resulted in 4 travel-related positive cases in the week. Since that number has grown to 13. Remember, this is one wedding. That number is now grown to 13 and potentially more through close contact. I just keep using this example to illustrate how the virus spreads and why it is so important to avoid close contact with individuals not in your immediate household. I was just on Facebook. I saw another beautiful wedding pictures. Nobody had on their masks. People, let's get real. I know you want the pictures and everything. It's a different time. Unless you're gonna test everybody before you go into the wedding hall and then lock the doors and do your thing, please just wear your mask. Let's be responsible. Our holidays are coming up. It's Christmas week. Our numbers are starting to look good again, and God willing, we will survive this surge without any loss of life. We were really good because we were able, number one, we worked out the one in St. Croix that we had with Lime Tree in that surge. We couldn't do the one in St. Thomas. We had to shut down because we didn't have the testing. We had another surge in the St. Thomas, St. John. We're working through that, and that looks good. We're below 50 cases today in the St. Thomas district. And now we're working on the one in St. Croix. So if we work hard, we ramp up the testing, we wear our masks, wash and sanitize, we'd be okay. Last week, the USVI was among the nation's states and territories that received the COVID-19 vaccines for the first time as part of Operation Warp Speed, a tremendous success, I must add. We received 975 doses of those vaccines, and we are expected to receive additional shipments as early as next week. The Moderna vaccine is now on island and is being distributed to our healthcare providers. As we speak, you may have seen the coverage of our local media, of our healthcare providers receiving and administering these vaccines over the last couple of days. There's a real nationwide push, especially for people of color, to come on and really convince other people of color to take the vaccine, as there's a lot of skepticism. We need to get to 80 to 90% in order to stop herd immunity, or to start herd immunity where the vaccine won't have anywhere to go, so it will die out. So please get on that plan. As the first phase of the Department of Health vaccination plan, 260 people were already vaccinated, which is good. That was last week. And I was fortunate enough to be one of those 260 individuals, along with Health Commissioner Encarnacion and Human Services Commissioner Kazi Gomez. All three of us went on Saturday. It's a very easy process. The nurse that gave me it was excellent. I didn't feel a thing. We went in there and got it on Saturday morning. And I know people are a little nervous about the vaccine. We had to stick around for 15 minutes to make sure we didn't have any adverse reaction, but all went well. And I wanted to make sure that I was personally taken to get this vaccine and let the people see that I'm taking it too. I always have this thing, there's two ways to lead. One of them is rank has its privilege. The other one is lead by example, and certainly I want to lead by example in this cause. It has been almost 3 days now since I received the vaccination, and I feel just fine. I will receive my second dose in early January. I think it's scheduled for the 9th, and I look forward to that. I truly believe that the availability of this vaccine, coupled with the increased testing and other federal resources, will help us get out from under this pandemic. I would admit I did have a little fever on Saturday night. I took some leave, and that was it. Been feeling great since then, and which is a normal side effect for the vaccine, so there's nothing to be alarmed about. That's just your body's immune system kicking into action. This weekend, other good news, Congress finally came to a decision on giving COVID relief funds again to small business, unemployed, and healthcare workers. And we're still waiting for these funds to get here and get the full agreement signed of everything. We know already it's going to have a second round of stimulus payments. We're going to get that queued up for Virgin Islanders, because we know a lot of people are out there hurting and don't have that cash, especially at this time of year when you want to do stuff for your family and your friends. We remain closely engaged with our federal partners, including the delegate, our lobbyists in Washington, especially Senator Manchin of West Virginia. Former Governor Manchin is just doing an awesome job of advocating for us and making sure that the territories are not left out. So we continue to do the most by making sure we're safe, and we're keeping people here locally safe from the vaccine as we move forward. So things are looking really good there. I also have some good news again for our teachers. I'm pleased to announce that we are working to make available through the CARES Act some funding to offset the personal costs incurred by our instructional staff at our public schools. For all the stuff that they went through implementing the virtual system, we want to make sure that we are supporting our teachers, all the extra tools, resources, internet, whatever it needs. And our teachers have gone way out of the way. And when I say teachers, I mean paraprofessionals, principals, administrators, all gone out of the way, our cafeteria workers, to make sure that they're doing things, funding new innovative ways to keep the students involved. Is not easy, and we want to encourage them in that. We want to assist in easing any financial burdens incurred as a result of our virtual learning mandate. Likewise, we continue to move forward on our existing programs to assist all Virgin Islanders negatively impacted by COVID. Another good news again, and maybe mixed message. Today marks another milestone and a record for the Bryan Roach administration. We have crossed the $100 million mark of total benefits distributed in a calendar year. This is more than 3 times the amount that was ever distributed in any year ever. It's a reminder of the tremendous challenges that we are facing and the ability of the administration to successfully navigate the tumultuous economic landscape. And as of this morning, the Labor has issued 49,740 checks, totaling $39 million to residents. Other pandemic programs, the pandemic unemployment compensations, that total $46 million. In addition to that, the pandemic unemployment assistance, that's $10 million. So we continue to do all the things that we are doing to make sure that we're cranking out those checks. If you need assistance or you haven't had a check, please check out our website at vidal.gov or visit their offices on Scion Farm in St. Croix and in Estate Content in St. Thomas. Tuesdays, Wednesdays, and Thursdays, they're open for the public. Today, there are 2 non-COVID related matters that I want to address. So, first thing is, earlier this morning, I closed on the $60 million revenue anticipation note. This is the $60 million of working capital that was approved by the legislature early this year. We have not used any of that money, but we signed on the note to make it available in case we run across some problems as the year goes. As we anticipate that while our money flow is looking and our cash flow is looking good now, that is not going to last. We're going to start to pay the price. We expect a light tax year next year, as businesses didn't really earn money this year. So what we're trying to do is assure that level of credit is available to us to cover our operating expenses between now and March 31st. It gives us that real insurance and assurance that as we move into the second quarter of the fiscal year, that we anticipate a decline in revenues, as I stated. But if we have that line of credit, we only have to pay back what we take out of it. So we want to make sure that we use it sparingly, and hopefully we won't have to draw anything at all. I want to thank all our partners, Banco Popular as well as First Bank, for their incredible cooperation in getting it done. On 2 different occasions, we have approached the Senate requesting authorization to refinance our rum cover over bonds. Initially, we were granted that authorization, but ultimately, we were unable to close because of the tight deadlines. Armed with the lessons from the first transaction, we sought authorization again to get a transaction. But this time, the second time, it was denied. The structure of the transaction front-loaded the savings to give the retirement system $255 million in the first 3 years, and then another $150 million or so in the second 3 years. The most dispute or concern I heard from the legislature was that, they didn't want to pay the escalated payments in the back, and they wanted a cap. So, almost the day after, or 2 days after we were denied, Puerto Rico, a bankrupt island, floated their bonds, got a great refinancing, and we're amazed that they got almost $3 billion in offerings for a $1.4 billion offering. That means there were $3 billion worth of people willing to buy their stock, even though they were bankrupt and they had an unrated bond. Well, we figured that we have to take advantage of this savings. We understand what the legislature doesn't want to take the risk. We're a little bit more risk averse. We're saying, let's put the money in GRS now and then work on a major solution as we move along. They're saying, no, we don't want to have that on our heads. But it would be almost foolish of us not to take the opportunity to just refinance the money, the bonds, at a lower interest rate. As a matter of fact, several of them called us asking us, why don't we do the same? We mentioned before that our goal was to put money in the GRS. Now, seeing the appetite of the legislature, we're sending this back on the 29th on a special session. And I'm calling on the legislature to allow for us to refinance this money. As I said, this is already debt that is issued to the Virgin Islands. So we're not taking out any money. We're lowering the interest rate, and we have the ability to lower our payment from $5 to $15 million, $20 million a year for the next 20 years. So, I heard a lot of conversation about why not wait and why not wait till the next legislature. I'm not a person that believes in waiting. Now is the time to do it. There's a lot of talk about the president, Congress issuing money to save us. I just told you about the resolution that just passed in Congress, the bill that just passed in Congress. That bill contains no money for state governments. The conversation on the Hill in Washington, D.C. about giving money to save retirement systems is non-existent. That vanished over 6 months ago. There is no one coming to save us. This new piece of legislation does not have any money earmarked for the GRS system. What it has is a reduction of the payment that we'll have to make on an annual basis. And what we do with that $15, $20 million savings a year is up to the legislature, as they have the right to appropriate monies and send them where they need to be. So I want to make sure that we all on the same page. I am not going to give up on the GRS nor the Virgin Islands. I will continue, along with Lieutenant Governor Roach, who stands firmly behind this initiative, to do the things that are financially prudent to give the Virgin Islands a fighting chance amongst COVID, impending hurricanes, the GRS cut, and all the other outstanding bills, liabilities that we have to pay. The 8%, the retro pay that needs to be allotted, over $10 million that we still owe our waste haulers for waste management. There are plenty things to do with the money allotted, and I'd like your assistance in encouraging your senators to vote in the affirmative for this when it gets to the legislature on the 29th. I also want to say this afternoon about an incredible feat by our delegate, Stacey Plaskett. I don't know if those of you are aware, but our delegate has been appointed to the Ways and Means Committee in Congress. This assignment is so monumental because this is the committee that shares out the money, and now we have an advocate for the Virgin Islands sitting there. I called her and congratulated her last week, and I'm still in awe of such an incredible accomplishment by our delegate. So I wish her well, and of course we'll keep working on all of the things that affect Social Security, Medicare, temporary assistance for needy families, better known as food sample welfare, SNAP. All those things she will have an access to now to help us in the Virgin Islands. So thank her for her service and congratulations. I also announced last week that we were saying farewell to Commissioner Petty. He is leaving the administration on December 31st, and certainly we are sad to see him go, but we wish him well on his future endeavors. Our current Assistant Commissioner, Dennis Brow, will be acting in his leave. We're down 2 commissioners, Finance and Public Works Department. We're hoping and interviewing all the time to fill those positions. If you are out there and you're interested in one of those positions, you have the credentials and you have a little grit and you want to work with the Bryan Roach administration, You could email me, give me a call at Government House, send your resume there are plenty of emails to send it to on the website, Richard Mota, or myself, albert.bryan@go.vi.gov. Other good news, this is the holiday season, and I'm not feeling like the Grinch. I'm feeling quite Christmassy. I did some shopping this morning, and I want you to do some too. Downtown St. Thomas, we're going to make the apron and waterfront free parking for the entire week. So if you want to go downtown and pick up something for your loved one, friend, family, whoever, or for me, please go down there. The parking is free on the tarmac, the waterfront apron for all week long to encourage Christmas shoppers to come downtown. I also have made a proclamation granting 8 hours of administrative leave on December 24th and 8 on the 31st. So New Year's Day and Christmas Eve are on me. Whole day off. Please practice safe social distancing. If you're going to move or go to the beach on those days, remember our curfew remains in place at 4 p.m. Just like our regular holidays, the beaches will be closed early on these days. So I've been having a lot of kind of stress, and just like you, about the holiday season, and no festival. Those of you who know me know I love festival, I love carnival and everything else. So I figured, how could we substitute this? How could we make it a little more fun for people this holiday season? And what I came up with is a house lighting contest. These used to be very popular back in the day when lighting was a little cheaper. And I know some of you are going to say, oh, the WAPA bill. Well, we made it rich this time. We have $25,000 in prizes for the best lighthouse light up you can do. This is going to be all 3 islands, separate prizes on each island competing. We even have a piece for boats to compete in this. You could sign up on the Department of Tourism website. But then once these houses are lit and we could put on the map where they are, people can get in the car with their kids and go on the map and look at all the houses without touching anybody or getting anybody infected with COVID. I think this is a great way to kind of create the holiday parade atmosphere, driving around looking at all these houses. So get your lights, get your reindeers, your Santa Claus, whatever it is, light up your home and make sure that you get registered at the department. Kyle Fleming of the Energy Office says, use LED lighting, that will keep your light bill low. There's up to $2,500 in individual prizes for winner and a lot more different types of winners. So you can get information on that at usviupdate.com/USVI LIT. So it's a lit contest. The young people, they use that all the time, like the Jam Lit. So this is a lit process with our Department of Tourism and the Governor's Office, $25,000 worth of prizes. Please participate. You can also get information by emailing dwilkes, DWILKES, @usvitourism.vi. I think that is about it for all I have for you. As I said, we have no Miracle on Main Street this year, so we're encouraging visitors to do downtown shopping and get on that. And before I'm done, I got another thing. We've been making some incredible strides this year, regardless of the COVID. We have done the best that we can. I'd like to thank the Daily News for a very nice editorial today on not the Bryan Roach response, but the Bryan Roach administration and the Virgin Islands response to COVID, about walking that middle line. And of course, those who sow in the spring shall reap in the fall. We have won Destination of the Year 2020, the Virgin Islands. That's a huge accomplishment for the whole tourism team, Commissioner Joe Bushelter. And I also like to wish congratulations to the Ritz Hotel, which was also awarded Hotel of the Year for the entire Caribbean. So that's a tremendous accomplishment as well. That's all I got for you now. I think we'll open up the line. We still have time for questions, as well as we'll have Dr. Ellis tell you a little bit about what's going on and what we're doing to keep you safe, regards to vaccine, COVID, and the rest. Dr. Ellis?
Good afternoon, Virgin Islanders. Governor Bryan has shared our latest epidemiology numbers, and we can see that we are feeling the effects of the recent spike in positive cases across the territory. As a community, there are simple things we can do to reduce the spread of COVID-19. As we approach the holidays, we must remember to celebrate safely. We shared this information before, but I would like to remind you of the way COVID-19 spreads. Close contact is still the highest mode of transmission, and we must all be mindful of our exposure to others. We all want to spend time with family and friends and spread holiday cheer, but these aren't normal times. The more people an individual interacts with at a gathering and the longer that interaction lasts, the higher the potential risk of becoming infected with COVID-19 and COVID-19 spreading. The recent increase in new cases is a reminder that you must be extra vigilant when you are outside of your household, especially if you live with someone who is immunocompromised or elderly. That population is most at risk. Many of us are excited about gathering with family to share gifts and to celebrate the season, but let's not forget your health and safety must be a priority during this pandemic. Remember these important tips. First, it's still flu season. Wash your hands often to prevent the spread of germs. Wash your hands with soap and clean running water for at least 20 seconds. Get the flu shot. Check with your primary care provider or visit the Department of Health. Everyone 6 months or older should get a flu vaccine. Second, learn to manage stress. Know when to take a break. Being away from family and friends can be stressful, and you might feel overwhelmed. Find ways to get support from loved ones, virtually through phone calls or video calls. Slow down when you need to and get adequate rest. If you feel that you need professional help, the Community Resiliency Project can assist you by providing free resources for stress management. Call them through Island Therapy on St. Croix at 340-719-7007 and through Insight Psychological on St. Thomas, 340-774-2228. Third, don't drink and drive or let others around you drink and drive. If you plan to drink, please get a designated driver. Always wear a seatbelt and ensure that children are seated safely in appropriate child safety seats. Fourth, don't smoke and avoid secondhand smoke. Smokers have greater health risks because of their tobacco use, and we have seen more severe COVID-19 symptoms in smokers. Fifth, prepare foods safely by washing hands and surfaces often, avoiding cross-contamination, cooking foods to proper temperatures, and refrigerating foods promptly. Sixth, eat healthy and stay active. We know a Virgin Islands Christmas means yummy food and desserts. Limit your portion sizes and foods high in fat, salt, and sugar. Try to get out for a walk or take a jog to offset the extra carbs this week. This is something the whole family can do together safely. Some residents have made plans to travel for Christmas, and some Virgin Islanders are traveling home to visit family. We are still strongly discouraging residents from non-essential travel as COVID-19 cases continue to rise in the U.S. mainland. Travel increases your chance of getting COVID-19, especially in areas with a high positivity rate. Staying home is the best way to protect yourself and others. If you must travel, please visit USVIupdate.com for travel requirements. Staying home is one of the safest ways to prevent COVID-19, but one new tool available to many is the COVID-19 vaccine. With the Pfizer vaccine being here since last week, and now the Moderna vaccine arriving to the territory today, I encourage you to use this tool if it's available to you. In addition to the vaccines administered last week, we distributed out another 320 doses of the Pfizer vaccine this morning to our partner distribution sites. I recently took the vaccine last week and feel great. The only symptom I did experience was I had it in my left arm, and I did experience soreness and tenderness in my arm. It is a shot into the muscle of your arm, much like the flu vaccine. And so my arm was sore for about a day, and that was it. I even went for my regular run later that evening. I ran 8 miles, so I really was 100% after the vaccine. From the Department of Health family, happy holidays and stay safe. To keep up with our EPI reports that highlight the latest COVID numbers in the territory, please visit the U.S. Virgin Islands Department of Health Facebook page and our website, www.covid19usvi.com, and for COVID-19 health information alerts, text COVID-19 USVI to 888-777. Thank you.
Thank you, Dr. Ellis, for that report. I think we have a couple of questions before we sign off. Can we get those up?
Hello, good afternoon. Hi, this is Luciba Knight from the St. Gravis. How are we doing today?
Good. Hi, Lasiba. Hope all is well.
Awesome. Thank you. Sir, you mentioned the recent PFA issuance of the $60 million in tax anticipation notes. And so
Yes.
in comments on that loan, you have noted that this money could potentially be vital to the ongoing operation of the government, alluding to the fact that it will forestall the possibility of layoffs. Can you detail for me how close we are to a situation where the government would be forced to start laying off employees, and any plans your administration has considered toward that effect?
No, we are not anywhere close to creating that layoff situation. However, we did take out all of the vacancies out of the budget to make sure that we're not adding to the burden in terms of how many people we have to keep employed. Our revenues continue to look good, but we never know when that can change. The market and other things are being artificially propped up now, and if Congress doesn't act soon to give some of the state supporting funds for territories, counties, and states to help with the budgets, we may be in a bad situation come somewhere around June next year.
Okay. And, sir, thank you for that answer. You mentioned that the Department of Health is about to get an infusion of CARES Act money. I was wondering how much unobligated funding is left from the CARES Act money. Of that money, how much has been, of that money that has been obligated, what departments was it directed towards, and in what amounts? The final thing.
That is a lot of money. As you know, we had a lot of different types of CARES Act funding. The only funding that was in jeopardy of being losing the money because of the time running out was the initial $75 million. Everything else has been pretty much spent or is about to be spent. We still have somewhere around $15 million left in that fund. We were scheduled to expend all of it by the end of the year, but now that Congress has also extended the deadline to next year for that money, we're kind of holding back on it and seeing what we can do in order to make sure we give it its best use. We've used like $20 million of that for salary support. We've also, remember, we needed the 10% match for FEMA. That was a considerable amount of money. We've invested in PAFFord, being here in the islands in case we had a surge, so we would have respiratory therapists, ambulance services at both hospital. We built out the wing in the Roy Lester Schneider as well, using some of those funds. We offered $1 million in scholarship for students, which they're getting their checks now so that they could either be able to be transported to the university or use it to buy their laptops or other necessities of the pandemic. We also gave $15 million through the WAPA payment for everybody, both business and commercial funds. So we've been spending that money at a pretty good clip, but as you know, we have a very conservative administration when it comes to spending, so we've been trying to keep our expenses down as much as possible, which allowed us to leave last year with about $100 million in cash before disbursements.
Awesome. Thank you very much, Governor.
Thank you, Lasiba. Go ahead. I think we had a question from
Yes. Hello,
Mr. Gilbert.
Bryan Gilbert, Day Construction.
Hey, how you
How are
doing?
you, God? Good.
Good. I haven't seen you in a while, man.
Yeah. I tried calling a couple of times, but I think there's issues sometimes. But I'm happy I'm able to get through today. A few questions, Gov. You mentioned about you're going to be sending that debt refinancing bill plan back to the legislature. You mentioned, of course, the situation in Puerto Rico, and they were able to find success on the market. What I was waiting to hear was potential changes that you made to the plan? Did you make were any changes made?
Well, yeah, what we did is we borrowed the money in a way that would give us the money to put in GRS up front so that we would save them, stop the bleeding a little bit in terms of the money that were being used. What we did this time is we didn't do that. We just took the lower interest rates, lowered the quarterly payment, and saved money across the board, which ends up to be somewhere around $300 million that we would save over the 20 years. So we didn't do anything fancy. We just sent it as a straight refinancing, and we'll see what the legislature has to say.
Okay, and so what does that equate to? Obviously, initially it was front end with the major savings immediately. Let's say it gets approval and you get the funding on the market. What are we going to see once that happens? How the savings in terms the monies we're going to see immediately?
We sent it to the legislature, several different scenarios for them to look at, but essentially, in the first 10 years, we save anywhere from 15 to 20 million a year, and then in the last 10, we save about $5 to $8 million a year.
Okay.
Each year.
And
each year.
Each year. Okay.
So I mean, immediately our payment goes down from over 100 million to about 80 or so, or something like that. So it's immediate savings, but we just don't have any lump sum cash, I mean, in order to put in the GRS system. So this doesn't help the GRS at all. Certainly we could assign the savings to the GRS, but it doesn't seem like we have the appetite to take that risk to put that front loading of that money in there. All of them seemed pretty okay with refinancing. Their problem was the debt service increasing in the last 10 years. So we gave it to them another way. Because we can't afford to let this opportunity pass us by. I mean, it'd be stupid for us to keep paying the high interest payment and not take advantage of the lower payment. It's like your bank calls you and offers you 2% when you were paying 3%, and you're saying no. So, they seemed pretty open to it when we offered it to them. Their concern was, they wanted to wait for the next legislature. Personally, we don't have another 3 months. We don't know what the rates are going to look like. No one's coming to save us, so we're trying to get it done now.
Right. So okay. So it's no longer necessarily to save GRS. You're saying it's just a prudent move to refinance at a lower rate.
Right. We tried. They didn't like it our way. We're still waiting for the legislature to propose new appropriations of revenues in order for us to float the GRS. We have several that we proposed. And so now we're just waiting to see what they're going to do. We continue to look for other solutions, but it's apparent that they don't like this one.
Okay, thanks, Governor. Let me ask, any concerns about the new strain of COVID-19 that is affecting Europe, specifically Britain? Of course, you've had Andrew Cuomo ask the federal government to shut down travel between UK and the US. The pound is drastically down against the dollar. Europe, the markets are down big time because of the new strain. What are your thoughts on that? Any concerns there?
I mean, totally my concern is always there, but I tend to worry about the things that I need to worry about immediately and the things that I actually have control over. That's the surge that we have in St. Croix right now and our increasing popularity for American tourists coming to the Virgin Islands and how to manage that and get through without shutting us down. That's what I'm focused on. That's what the administration is focused on, getting looking forward to 2021, making sure that our projects get up and done. We get about $550 million worth of capital projects that we want to get that money on the street. Those are the concerns right now that we're focusing on. We're watching it from afar, but for right now, we can do what we can. We have the vaccine. Please take it. It's important that we secure our community with so many people coming in and out.
And so, Governor, to that end, I know you mentioned a few weeks ago about the strategies with the airport and getting that up and running to have a more secure situation and protocols are put in place. You mentioned the fine. Again, with this new strain and concerns about the virus surging, where are we in terms of really setting up the airport situation?
You know, the airport is, you know, people keep pressing the airport, but we tested the airport, and out of the 11 months we've been there, I think we must have had maybe 10 people, and I'm being generous, found at the airport with COVID. Our real problem is in the community, so while we're still testing at the airport, we're shifting our strategies to pop-ups on 3 islands. We have them at Home Depot, downtown. We're doing it at community centers, Plaza Extra, grocery stores, trying to find people where they go. The airport is not a threat, and statistically you can see how we've been able to control that situation. We are doing some extra things. The portal now, we got to set it up so it can show that if you have the vaccine, that you can prove that you have the vaccine. We also have to make sure that as we get more tourists in, like right now we have so many planes landing on the island of St. Thomas that we need to assign more personnel to check people coming in so that line moves faster and people are safer. So if somebody's infected, you're not with them at the line. We're also ramping up at the testing so that if you haven't tested and you're coming to the Virgin Islands, you can get tested.
I'll follow up on that, and then I have one question for Dr. Ellis. I know you said the airport is not hasn't been a problem when you look at the data and the statistics, but I personally went to Puerto Rico recently, so I took a test locally, and the test was negative, of course. I went to PR for a day, came back, went through the process, and folks asked for my test, right? I showed it, and they looked at it, and I signed some documents. But then there were some other people on that same flight with me, and those persons who asked, so, you know, have you tested? You know, do you know if you have COVID? The person said no. They just signed, and then they walked out. There was no testing or nothing done. So I'm not sure the statistics are showing, or the data, you know, is thoroughly accurate there if you have folks who could just go through. So that is, and I
what
know
is
that's
accurate
what
though is that since COVID in March, we've had exactly 2 tourists infected. 10 tops, we've had 1,300 cases of COVID in the Virgin Islands. So we'll continue to tighten our airport, but statistically we could show you that the airport is not the weak point now. Our weak point is always where it's been, in our social circles, in our bars, our restaurants, the parties. That's where we're seeing it. We just got to keep cracking and getting people quarantined as quickly as possible.
Argo, thank you very much. Let me just ask Dr. Ellis a quick question in regards to the Pfizer vaccine. I know she said, I know 200 plus were already administered, and another 300 plus have been sent to the various partners for administration, to administer the vaccine. In terms of storing the vaccine, I know the Pfizer vaccine needs dry ice, and so some concerns, there were some concerns around whether the territory would be able to safely secure the vaccine and keep it good or what is the duration of time can the territory hold the vaccine and make sure they are safe before they are administered. So if you would talk about that process there and how we are keeping the vaccine doses safe.
Yes, definitely. That's a really good question. And there's there's very specific guidance that we're following from Pfizer for the safe storage of the vaccine. It's currently all of the doses that are in the -80. We have a -80 Celsius in the public health laboratory. That's an ultra cold refrigerator. Those can be stored at -80 for up to 6 months. And when they're thawed, like this morning, we thawed a little bit over 300 doses. We send them to all the distribution sites and partners, the partners that are giving the vaccines. We send them on cold packs, and so they're thawed and they're stored on cold packs. So that's at 4 degrees Celsius. Once the vaccine is thawed, it can be stored at 4 degrees Celsius for 120 hours exactly before it has to be discarded. So it has to be used within 5 days. And then each vial of vaccine contains 5 doses. Once you open up the vaccine and add the diluent to it, it can be stored for up to 6 hours at room temperature.
Excellent. Doctor, thank you. Governor, thank you.
Dr. Ellis, if you can you explain how many doses per vial? Because I know people are thinking about this vaccine like it's a big case of something. How many doses per vial and what it looks like in terms of how many vials totally did we receive?
Yes, definitely. The vaccine contains each vial contains enough doses for 5. So we're making sure that we schedule everybody to get the vaccine in groups of 5, because once you do open that vial, you do have to use it within 6 hours. So to ensure that there's no wastage, each dose is 0.3 mLs. So 1 ml is not even a teaspoon of vaccine. 0.3 mLs is a very small amount of vaccine that's injected into your arm muscle. And like I said, there's 5 doses in each vial, so to vaccinate 5 individuals.
So people were asking me on the street, I've heard this question a number of times, where's the vaccine? How come we didn't see the plane land? It's only 200 vials, that's 975 doses. It's not a huge, big thing that you can, that they have to send a plane here by itself. So, we have, and people are asking, why did it go to St. Croix? That's where we have the public health lab. It's where we have the super cold freezer. So we're getting it out. We're starting to getting more doses. We hope that the public cooperates and, takes the vaccine so we can make this Virgin Islands safe and keep ramping up. And hopefully, there's a thought in the air now that I've been toying with around from a recommendation of my good friend Kane McGrath. He said, how about Carnival in August? I said, you know what? That's not a bad idea. So let's try to get vaccinated. Let's push back Carnival to August. Maybe we could have Fete in August. We'll be done with this coronavirus, and hopefully we won't see any part of this new strain that is supposedly coming aboard in Europe. Until then, I want to wish you, on behalf of my family, a very, very, very happy holidays, happy Hanukkah, happy total season to you. And I just want to say, love you, God bless you, stay safe, stay sanitized, wash your hands, and wear your mask. Take care. Virgin Islanders, the holiday season is always filled with love and togetherness. Now more than ever, COVID-19 has taught us to cherish every moment with those we love. Special holiday greetings to those on the front line as we battle COVID-19, to the doctors, nurses, first responders, our men and women in uniform, to those who kept our shelves stocked in our stores, and everyone who kept the Virgin Islands running. Thank you. Remember, we are still in a state of emergency. Wear your mask. Practice safe social distancing. From my family to each and every one of you, season's greetings.
On behalf of my family and staff, I would like to extend season's greetings and best wishes for the holidays. As Virgin Islanders, we are by nature expressive and effusive in our interactions. Ours is a unifying nature that breeds love, happiness, and fulfillment. This year, we faced unprecedented challenges and adjusted accordingly. We made changes in our daily routines and incorporated new health and safety practices. Now we bump fists or elbows when we meet instead of the warm, satisfying hugs which are our custom. Yet even while we embrace this new norm for our safety and that of our neighbors, we can still continue to care for each other with compassion, patience, and a positive outlook. God bless you. Happy holidays.
Hi, I'm Health Commissioner Justa Ortita Encarnacion. It's that time of the year when we usually celebrate the season with good food, quail and calypso. combined with many live and exciting events. We're all disappointed about not having in-person festival celebrations, but this is the safest way to celebrate our culture amid the COVID-19 pandemic. The Department of Health encourages you to celebrate virtually and to participate in the many virtual events hosted by the Department of Tourism. We want to discourage you from gathering in large groups and creating your own private festival events, as these parties and trams can be a major source of spreading COVID-19. We want you to have a good time, but in a safe manner, which involves wearing your mask and not congregating with people outside of your household. Remember to wash your hands, stay home if you're sick, and always report your symptoms to the Department of Health by calling 340-712-6299 or 340-776-1519. Avoid traveling to celebrate the holidays as your risk of getting COVID-19 increases when you travel. If you must travel for any reason, visit USVIupdate.com for travel requirements that include testing before you travel. Have a safe and joyous holiday season.